Are you suffering with shoulder and arm pain? A pain that's been gradual in its onset, no explanation of why it started, no injury, no trauma, but you feel that pain is becoming worse and you're starting to develop restrictions in movement, such as bringing your arm out to the side like this, taking your arm and bringing it into the sleeve of your coat, bringing your hand up your back, or simply just taking your hands to your head to wash your hair. There's a chance that you may have a condition known as adhesive capsulitis, commonly known as a frozen shoulder. Now, a frozen shoulder has 3 phases. Phase 1 is the freezing phase. This tends to be the most uncomfortable, where the pain is at its most acute, most sore. Any sudden movements causes a very intense pain in the shoulder that can really make you feel quite unwell as a result of that. At night time, the pain tends to be a lot more active, a lot more intense, which can disturb your sleep, then causing more tiredness, less tolerance to pain, can really make you feel quite miserable. Then stage 2 is where the shoulder actually is a lot more stiff, and you find that the movements in all planes of movements really are quite restricted, still painful, but not as acutely as intense as it was in the first phase. Then you have phase 3. Now, phase 3 is known as the thawing stage. That's when the shoulder starts to free itself off and movements start to return. It can still be a little bit achy and sore, but nowhere near as painful as phase 1 and phase 2. Normally, a frozen shoulder will resolve itself or will go through those 3 phases within a period of around 12 to 18 months. It does depend on an individual's past medical history, general health, and how active they've been in trying to rectify the problem. A frozen shoulder also responds really, really well if caught early in phase 1. Now, you are most likely to be most active at that stage because it's when you're going to seek the help the most, because it's very painful. You're going to seek pain relief options. You're really struggling on why that you've got this problem, and you're more likely to reach out for that medical advice. One thing that I would always advise anyone who's having any of these symptoms, that you should go and have a physical examination, whether that be with your doctor, whether that be with a physiotherapist or an MSK clinician of some sort, as you may need a routine x-ray of the shoulder just to rule out anything that could potentially be causing those symptoms. That's not a frozen shoulder, so to speak. That's not to worry you, it's just to make sure that we're ruling out all differentials that could potentially be causing your symptoms. And if you have your x-ray and everything comes back perfectly clear, and it's looking likely that you do have a frozen shoulder, there's many different treatment options out there that can help you in that phase, which could also possibly prevent you from going into a phase 2, where you would then have a full frozen shoulder. Today in this video, I'm going to give you the exact exercises I give to my patients who are struggling with pain and stiffness within the shoulder, that most likely is, or they have indeed been diagnosed with a frozen shoulder, on how to bring your pain down, how to get the shoulder moving, and more importantly, prevent it from becoming a true frozen shoulder. So let's get to the exercises. Now, when the shoulder feels really stiff, really sensitive to any sort of movement, or it becomes aggravated from you trying to move the shoulder, so you become reluctant in moving it, what you should do is start with a really gentle mobility and stretching exercise, so we can put a stretching load on the capsule and do gentle grinding movements, so it helps stretch the shoulder, but also grind out any of those adhesions that are developing in the shoulder that's causing the stiffness in the first place. And what we're going to do is what's known as pendulums. Pendulum exercise number 1. Now, all you need to do is stand side on with your good side facing, whether that be your kitchen counter, the back of a dining room chair, anything really where you can lean on it and lean forwards. Then with your affected arm, you want to allow your arm to go really dead and heavy against gravity. And you want to feel like the heaviness going to your hand and to the tips of your fingers. Once you've got that, you know that you are relaxing your shoulder. From there, you want to very gently just move your shoulder forwards and backwards, nice and gentle. It should be a really small movement. Now, if you're doing larger movements like this, you're recruiting too much muscle activation, and that's not really giving me what I want. I want you to make sure that your arm feels really heavy and dead. The movement that you're trying to achieve is really small. It should almost be like the wind is giving it a gentle push forwards and backwards, nice and gentle. And you want to do this for for around 30 seconds. Once you've done that, you can relax, give yourself around 10 seconds, bring yourself back into the position again. Now this time, you want to take your hand from side to side. The same method applies. Allow the arm to become super heavy. All right? You just want to do a slight movement, just a gentle movement, as if that arm is being blown in a breeze from the wind. Nice and gentle from side to side. And you want to do this for 30 seconds. Now to take this exercise to the next level, you can get yourself a tin of beans out of your cupboard or a very, very light weight, so you can hold that in your hand just to put that little bit more tractional force through the arm. And then you just apply the same exercises, forward and backwards, nice and gentle. Then you can do the ones in side to side. Once you feel that you can do these exercises and you're not really getting the same agitation, and if your shoulder's feeling a little bit freer, you can move to stage 2, which we're going to go into now. And what you need is a stick. Now, I'm using an old elbow crutch. For you at home, if you haven't got anything like that, no problem. You can just use the stick of an indoor broom, mop, anything really that's really light but sturdy and stick like this. Now, these exercises with the stick are called active assisted exercises. Now, what you're going to be doing here is using your good arm to assist your poorly stiff arm into your shoulder movements. So, for example, forward flexion. If you find like you're struggling like this, what you can do is grab hold of the stick. Your starter position is where you rest the stick on the front of your thighs. You're then going to slowly bring the stick all the way up above your head as much as you feel that you can go. Now you may find you only get to here, no problem. If that's as high as you go, you come back down nice and slow with control, and then you go up again. And each time you just try and nudge it that little bit further. Try not to go on angles like this. Keep the stick as straight as possible. And you want to execute this 10 times. Now, if you find that you're giving it all of this and it's too difficult to do, a tip for you is lie down on your back and do the exact same exercise. You will find that there's less gravity going through your arm to lift the arm up, but also you'll find that you won't cheat as much because you've got the floor or the bed or whatever it is that you're doing the exercise on to give you that extra support. The next exercise is going to be assisted shoulder abduction. With your poorly side, take your hand to the end of the stick. With your good hand, take it as far as you possibly can to the other end of the stick. Now your good arm is going to gently push the poorly arm out to the side as much as you feel that you can go, and then nice and slow on the way down. So the poorly arm here really should be going for a ride. It's not doing the movement, it's not lifting the stick, it's just nice and gently being pushed into the abducted position. And you want to execute this 10 times. Again, each time trying to go that little bit further, that little bit higher as pain allows. Again, if you find that this is too difficult to do in standing and you're moving like this, try it in lying. The next movement is external rotation. This is one of the movements that tends to get affected the most with a freezing/frozen shoulder. So what you're going to do, the poorly side again, is going to be at the end of the stick. Your good arm as far down the stick as you can possibly go. With your arm tucked at a 90-degree angle, like so, you're going to push with your good arm, the poorly one out to the side as much as you can go, and then slowly return to the rest position. Push it out again, and then bring back to the rest position. Let me show you on a side angle. So out to the side, and nice and slow on the way back. Try and maintain good posture throughout this movement. Try not to cheat by twisting your body or lifting your shoulder up. Try and stay as still as you can, and make that poorly shoulder do all the movement. Now again, you can trial that in lying down. Same method, but you keep the arm tucked into your side at a 90-degree angle, your back nice and flat on whatever it is that you're lying on, and then you're persuading the arm or you're pushing the arm out to the side as much as you can, like this. And you want to repeat this 10 times. Now, the next exercise, you're going to bring the stick behind your back. This is going to help with the restrictions when trying to bring your arm into the sleeve of your coat. So you're going to bring the stick behind you, then you're slowly going to take the stick away from the body as much as you can, hold it and slow on the way back. As soon as that stick touches your bottom, you want to be pulling it out again. And you're going to repeat this 10 times. Once you've done this movement, keep the stick at that resting position. Then you want to bend your elbows as much as you can. trying to bring the stick up your back as much as you can, and then nice and slow on the way back. Now this starts to introduce what's known as internal rotation. You want to repeat this movement 10 times. Again, try and keep your body nice and still with good posture. Try not to lean forward. Keep yourself nice and steady, nice and still. The final exercise, you're going to try and bring your poorly hand behind your back as much as possible. You're going to hold one end of the stick with that poorly hand. Then your good hand goes to the top of the stick that should be positioned at the back of your head. Now in this position, the poorly arm should not be doing anything other than holding the stick. Now from here, your good arm is going to pull the poorly arm up your back as much as you feel that you can go. Hold it for a second, and then nice and slowly back to the rest position. And you're going to repeat this movement 10 times. Now these exercises, unfortunately, can be really uncomfortable, painful for that matter, but you have to get the shoulder moving. For this particular condition and for this video, remember, motion is lotion. You've got to get that shoulder going, and I would advise that you repeat each exercise 2 to 3 times in the day, but spread it out. 1, so it's tolerable, and 2, so the shoulder is being mobilized throughout the day. But what's more important than that is the consistency. You have to do this day in, day out. And if you find that you're not able to do it because the pain is too high, I would again advise that you speak to your local doctor to discuss what painkillers are appropriate for you and what will work for you so you can tolerate these exercises. I sincerely wish you all the very, very best with it. Please leave me a comment below. Let me know how you get on with the exercises. If there's any questions you want to ask, I will try and answer them the best that I can and help you in any way that I can. Please don't forget to like, share and subscribe. And more importantly, if you know anybody, friends, family, or someone who knows someone who is struggling with shoulder pain, shoulder stiffnesses, please share this video with them. You never know, it may help them. All the best, and I'll see you on the next one.